The desire to be a liver donor often begins as an emotional decision and desire to help a patient who is very ill. However, it is extremely important that a potential donor be educated about the procedure and risks, as well as consider the impact being a donor could have on their life and their future. They need to ask themselves several questions. These include, number one, am I informed enough about the procedure, risks, and potential complications to make a decision as a donor? Number two, am I emotionally ready to be a donor? You could be approved or not as a candidate, and the donation surgery may be successful or not. These could be very difficult things to cope with. Number three, am I physically ready to be a donor? Am I strong enough to go through the surgery and recovery? Do I have any current medical conditions that I worry could become worse as a result of being a donor? Number four, am I financially ready to be a donor? Could I be off work for 3 months or more? Would I have concerns about lost wages, travel expenses, or any other life expenses during this time? Number five, do I have one or more people available and willing to be my caregiver? Am I the caregiver for children, parents, or others? And who will care for them while I am recovering? The caregiver or caregivers will be required to be present and active participants during all phases before, during, and after the surgery, as well as the recovery. If you are able to answer yes to these questions, then you could begin to consider post-donation issues. Sometimes, living liver donors encounter one or more psychological issues after surgery, especially if their recovery is not what they expected, or if the recovery of the recipient is not what they thought. There sometimes can be disappointment. Also, there's a level of pain and discomfort associated with being a donor. It's important to have coping mechanisms in place. Another consideration would be the surgical scar. It may be important for you to ask to see pictures of other donors and what their scar looks like in the shape of an L. You could have body image issues as a result of this scar, and it is an important consideration as a possible donor. After the surgery is over, there could be a period of adjustment, which could cause anxiety or even potentially letdown once the surgery is over and you go home to recover. It's important to keep in touch with your transplant team in case you encounter any of these issues. One cause of anxiety could be the recipient having problems in the recovery, including rejection or even a possible need for retransplantation. Though this risk is small, it is something that is possible. It is important for you to consider prior to being a donor. Another issue could be that the recipient could have a recurrence of their initial disease that caused the liver failure, or unfortunately, the transplant recipient could even die after the surgery, despite having the living liver donation. After the surgery, you will continue to adjust to your recovery and the impact of that donation in both positive or negative ways on your lifestyle. Though it is not a requirement, you may want to consider talking with another post-transplant living donor volunteer prior to the surgery to discuss any concerns or worries about the procedure. As mentioned, there are financial risks for living liver donors as well. The bulk of preoperative, operative, and postoperative medical costs are usually the responsibility of the recipient's insurance. However, some costs are typically not covered, such as travel, lodging, lost wages, childcare costs, potential loss of employment, or even a concern about inability to obtain future employment. You could also incur future health costs not covered by the recipient's insurance, or be denied health, disability, and/or life insurance. In the state of Ohio, you would be eligible for a $10,000 tax deduction as a donor. You can discuss other states' tax deductions with your social worker. As a reminder, you must have a caregiver as part of this process to help you with your recovery. After a typical 6 to 7 day hospital stay, you will be released for discharge, but still be recovering. A caregiver commitment of 2 to 3 weeks is necessary to assist you through this time. You will have limits on your daily activities and will not be allowed to drive for at least 3 to 4 weeks during your recovery period. The donor team will follow your progress very closely.